All right, so I guess my first major aspiration would be to become a faculty member, kind of change the way people look at pharmacists by helping students take on roles in pharmacy that are evolving and changing. And the second is to be well published. Pharmacists have kind of a role, and I feel like a responsibility to contribute to new knowledge, especially as we're taking on more clinical roles and as we're getting more public viewed as people who are contributing.
Okay, excellent. Pharmacy education?
I actually had one at my school, Dr. JVA, Dr. Van Amburg. And she's
I didn't know. That makes sense now because I know her, so all right.
And she's actually in the role that I kind of want to be in. She's an assistant dean and she's a professor and she's really well respected.
Yeah.
She publishes and everyone loves her as a teacher. So she's really someone that I look up to.
Yeah, she's very active in AACP.
My experience here at AACP has really solidified my plans actually, which is kind of nice because I wasn't sure what I wanted to do. I learned a lot about administrative responsibilities, but I also learned that I really want to see patients. So I don't want to be in an office all day or just be in the classroom. I really want to see patients, which is what I originally wanted to do when I first went into a healthcare related field.
Like, what's next?
What's next? So what's next is residency. I'm looking to do kind of a PGY1, PGY2 with an MBA component just so that I can really hone my administrative skills and business skills. And then after that, possibly pursuing a fellowship if I'm not already sick of learning. And that's just to really get down my researching skills because you don't really get enough of that in school or in a residency program. And then hopefully after that I can finally get a real job.
Yes. Pharmacy education.
Pharmacy education really is at the forefront of the changing history of pharmacy. So that's really exciting to be playing a role in pharmacists really entering the clinical field and people really respecting what we do as a profession.